Hi everybody, welcome back. We're going to do a real quick couple-minute video on how to overwrap a cast post-surgery. We'll talk about that briefly, but you want to start with the following materials: basic stuff, some safety scissors, and the color of choice the patient has chosen for their fiberglass overwrap. We're going to pause here and we're going to move over to the patient and we're going to get started. So the first thing we're going to do is we're going to remove this Coban tape. There are surgeons that will place a wrap of Coban tape over the fiberglass because they do a split post-op to allow for any swelling that may happen. This one is univalved. Some surgeons will bivalve it. They'll put a split on both sides and they'll have spacers, or they'll have cotton, and you can take that out. Remove the spacers or remove the cotton. Make sure that the crack is nice and clear from obstruction, and then we're going to seal it shut with a top layer of fiberglass. So what you do is you wet the fiberglass just a little bit so that it'll adhere. If you lay the fiberglass, the wet fiberglass, on the dry fiberglass, it will not stick. So that you have to make sure when you're laying the fiberglass down that you put a layer on top of each previous layer that you lay down so that it will actually stick to the pre-existing cast. If you just lay the orange on top of the blue, it will not stick if it's just one turn. Not only that, but if you lay it on thin, it just doesn't look professional. You'll notice I am giving a little bit of tension to seal this crack up. We all know that after 72 hours, the swelling will start to diminish. Most surgeons will have the patient follow back in clinic anywhere from 4 to 5 days after surgery up to a week, so that we can check the status of the patient, as well as if there's any swelling or discomfort or any complications post-op. And then they'll give you permission, as the ortho person, they'll give you permission to go ahead and overwrap it. And this will be basic fiberglass overwrapping of a post-op cast. And what you've done, if you look at the edges, you'll see how now the univalve split is now sealed. But you want to leave a hint of it showing so that when the patient returns, the ortho person or the medical assistant will know where exactly to cut, so that you're not trying to cut through both layers. You can actually just cut through the orange layer and it'll be easier on the patient. Then what you'll do is you'll reach around, grab some lotion or some soap or some sanitizer. Some people even use Surgi Lube, and you're going to want to do a little smear. Rub it all around the fiberglass so that it kind of seals the fiberglass, gets rid of that tackiness from the resin, and now you have a nice sealed post-op fiberglass cast. And this is how you do your basic 1 week follow-up overwrap.